those kinds of things. We were going to talk about drains, right? And someone already asked about it. The drain, well, it's an option for some surgeons. It's not wrong. Some surgeons have gotten used to it. June and I, for about half of our professional lives, used drains. Our clinic has been around for 15 years. We used drains for 7 years, and we've been 8 years without using them. Yes, there is a surgical technique that basically consists of, at the end of the surgery, closing that dead space by placing stitches with absorbable thread, a thread that will dissolve, joining the skin to the muscle. So we close up that space. This prevents the formation of seromas, and even if there is a hematoma or a small bleed, it is contained and remains minor, making the use of drains in abdominoplasty completely unnecessary. We simply don't use drains anymore. Then people might ask, but in every case? Abdomens where we've removed, for example, 10 kilos of skin from a patient. 10 kilos. It was a very large apron of skin. And we didn't use a drain. Yes, we perform abdominoplasties, including circumferential ones, 360 degrees and sometimes in an anchor shape. Obese patients, right, who need a large amount of skin, of skin removed. Patients who have lost, are you thinking 80 kilos? If they've lost 80 kilos after bariatric surgery, just imagine the amount of skin. And even in those patients, we don't use a drain. So just imagine in regular aesthetic abdominoplasties, right?
Normal, and more important than that, we don't use drains and we don't get seromas or hematomas. That's what's most important. It's about improving patient comfort without compromising postoperative recovery. So we found that by placing the quilting sutures properly, we can reduce this risk to practically zero, just like the hemostatic net for the face, right? After we started using the hemostatic net, we completely eliminated hematomas.
Gone.
And it's the same thing with the quilting sutures, right? With these adhesion stitches. Once we really learned how to do them correctly in the right way for our surgeries, we eliminated seromas and hematomas.
I'm going to talk a little bit about our personal experience, okay? For 7-8 years, we used drains and we had, on a recurring basis, seromas. Some patients, it was just part of our daily routine. The moment we learned to place these quilting sutures and stopped using drains, nowadays it's very rare to have a seroma in the clinic in abdominoplasty. It's very rare. Rare as in 2 or 3 cases a year, It's something we can't even remember the last time it happened, right? And well, the drain is an undeniable and significant entry point, whether you like it or not, for various types of harmful bacteria. So there are patients who go home and stay with the drain for 5-7 days, right? We don't like that. And yeah, the drain entry site, besides being a gateway for back bacteria, ends up leaving an ugly and unesthetic scar. Unesthetic. Sometimes surgeons place it on the pubic area and it leaves a scar there because in the past, patients used to shave less. Nowadays, the standard for shaving, I'm not a woman, but I believe it's changed, right? So you can't have that little scar left there on the pubic area.
That's when it heals well. And what about when it doesn't heal well?
No. I don't think it heals well.
In fact, I find it strange. There's now a trend in plastic surgery to use drains in liposuction. This is becoming more and more common. And about 3 months ago, I had a patient who asked me why she didn't have a drain placed during her lipo. And I kept wondering, okay, but I don't understand why that is.
Is it just a trend?
It's a trend that came from abroad.
It came from Colombia, from Colombian surgeons. Yeah, and basically June and I have a philosophy. Nobody goes home with a drain. So if we place a drain during surgery, we remove it before the patient goes home that night or the next day. But in abdominoplasty, not even that. Sometimes, we're talking about basically a major breast reduction, right? We put in a small drain which stays for 12 hours and then it's removed. And face,
Explant.
explant, right? For face, we never use drains anymore, right?